All Real Radio in the house right here, to the radio personalities. Y'all, so we have people in person. If you hear background noise, we have to let people network. This is so important, right? So we did the best we could. That's what, that's what people say when they're raising people. No, you didn't. That's what Margot Bain says.
Hey, I say it every day.
Hey, you say it every day. Okay.
I did it.
You did it. You did it. All right, y'all. So next, we are talking, hey, our audience, can we come down just a little bit? We still got our virtual people going. You addressing us? Okay, thank you. So y'all, I have Sierra here with me. Sierra is a melanin mother with a Melanin Minds, Sankofa Mama, a broadcaster, radio personality, a doula, just everything. Homeschooler,
Yes.
a homeschooler and everything else. So you today are going to be talking about how we can show up better for our melanin mothers, and you're going to be hitting 3 different points about that. But before we get started, we would love to know, how did your mission become your mission, and when was the moment you found your calling?
I had 2 moments. One is named Maya, and one is named Naima.
Ooh, those are children.
Yeah,
Okay.
tiny people. I grew them right here, and that's when the moment began.
I love that. So what was it? It was Thursday. We were on the radio for my radio show, Let's Talk, adult hour, night talk. And you cut for your community. And this is how I met you. Like, we were both new to the station about the same time. Now we're not the babies anymore.
We're not, but we were.
We were the babies.
I felt the immediate connection.
We were like, okay, we're about to do this. And then the storm hit. The storm in Houston and Texas, the winter storm.
Yeah.
And Sierra was like, that's not enough. Everything going on in the community, everybody helping, that's not enough. And you reached out to our owners of All Real Radio, Denise and Drew, and you came up with this huge drive as a resource for mothers. You want to talk about that a little bit?
Yeah, so the movement is called We Got Us.
We Got Us.
And it still lives.
It does.
I'll explain that in a minute, but it's so frustrating when we have all of this money and all of this power and this so-called infrastructure, but none of that does anything to really support us in a way that we feel it. And so you feel it in times like a natural disaster. And I myself went without power, just like everybody did, power and water and just all of that. And the frustration just built up to a point, but I only let it get to a certain point because I always feel like I don't want to wait to see like who's gonna do it. Like, let me just do it. So We Got Us. I decided we didn't need to wait to see who was gonna come and rescue us, especially in our Black and brown communities. And so I got on the phone with some great people that I'm blessed to call my folks. And in 24 hours, these people came through. We wanted to focus on mothers, families with children, being a birth worker. That's where my hands are all the time. So I called up my fellow birth workers, and they showed up. I mean, the radio station showed up. You guys showed up. I don't know where volunteers even came from in 24 hours. And we put together a whole entire drive, thousands of dollars worth of diapers, formula, wipes, people driving in from out of state, pallets of water offered up to us just because we said we want to do this. And there were other organizations in the community like Sierra McClain-Henry, Texas, who saw that, and they too are about it, and not about trying to wait and see who is going to do it. And so just joined together, community in action, and we were able to do it not once but twice. And we were able to serve folks, and we are still getting donations of items that families need, especially families with young children and babies. Also items to take care of your body as a woman, whether it's postpartum items or menstrual care products. Menstrual Flux came through also. I have to shout them out.
Oh, nice.
Menstrual Flux really came through. Yeah. In 24 hours to have an organization that themselves, they're reaching out to the community and asking for help, and then they just show up with, they're like, we have 100 packets of products for you that'll last an individual 3 months. That's a big, big deal. And that was just a little bit of it. So many different organizations around the city that had their own things going on. And instead of being like, well, this is us and that's you, and we don't have nothing to do with that, they were just like, what do you need? Because we have a lot. And so we just kind of joined together, and then we had a lot of certain things. And so, you know, it's like, okay, you guys are focusing on food. I got this food for y'all. And they're like, cool, I'll drop off the diapers. And that's how it worked. And, you know, we were funneling folks to other places and helping them find the help they needed by the community. Like, I asked volunteers, like, hey, can you drive over to this food drive that's on so-and-so side and see what they have and what do they need? Yeah, we were just, it was the community, like, for real. It was the real deal.
It was good. It was good
we
stuff.
got us, and that was the thing, to know that, you know, we showed up for ourselves.
Showed up
And it's
showed
not
out.
always about waiting to see what they're going to do for us.
You got us.
We got us.
I love that. We did do it twice, and I was talking on the radio on Thursday night, and I said, I just want to have a child so that Sierra can be my birth worker. I was like, if I want ice at 33 degrees, she's gonna make sure that the hospital or wherever I am takes care of it. So we're gonna 33 on the seat. You just remember that. So I'm gonna let you jump into this. We appreciate you being here. And we want to know, you know, what the doulas do, what a Sankofa Mama does, and everything else.
We were gonna get into Sankofa.
Okay.
So
I'm gonna hop off, and it's all you.
It's on me.
All right, sis. Thanks so much.
Yeah, no problem at all. So I am a birth worker, and I have to start there because, you know, we hear all of these different calls to action for people and to show up for people and to show up for our communities. And really, with birth work, we're starting at the very beginning, where the community starts, literally, where we all have started, and those lives that matter, that we want to matter when they're big and grown, and they matter from the very beginning. And so with my hands in this work, diving into maternal mental health is something that is a part of that package. Doulas help to shift the paradigm when we talk about this Black maternal health crisis, melanated mom maternal health crisis. We have a lot going on, and, you know, it's time for us to rise up, and in the same way that we got us, to have each other, to have ourselves. And so social media makes it really popular now, but we have been doing this for our communities. We've been showing up, offering culturally competent care. It matters. Being seen matters, especially being seen and knowing you're seen and held in spaces that are causing us harm. And that's what's happening in the hospital systems by and large, and not just in the hospital systems. It's happening at the hands of folks who just don't value us. So that could be a midwife. That was my own experience, and I'll get into my own story in a bit. But, you know, we have to show up for one another. We have to watch out and care, and that culturally competent care is something that really matters. There's times when we show up for one another, literally as a watchdog in these situations. And I would even go as far as to say, no Black or brown person should go into a hospital setting without having a second set of eyes, someone who can watch out for you. The way you're treated matters from the very start of your prenatal care. Too often, our Black and brown moms especially are treated in a way as if you're to be suspected of something as soon as you go into that relationship. I recently had a doula sister of mine who has attended many hospital births herself, find out some really hurtful information that she was being judged at her appointments because of what she wore when she came the first few times. Could barely keep anything down, you know, literally crawling out of bed because she's not feeling well. She made it to her appointments though, and, you know, they're putting notes in her chart about the way that she was dressed, and, you know, making, you know, these ridiculous statements about, you know, what that could mean, and, you know, things that they should look out for once the baby gets here. And those kind of things happen all of the time. So having someone who understands where you're coming from, because many of us birth workers are moms ourselves. So we're coming into this work either from what we were lacking in our own experience, or just from the desire to not see this continue happening. Doulas can provide individualized care, seeing to exactly what you need. You know, your care provider, your doctor, they have a lot of clients, a lot of patients. They don't have time to call you every week and just say, how are you doing? And just listen to you. We do. We have time for it. Matter of fact, we have time, and we actually have special training for it. We have time to look into what your needs may be, beyond just, okay, are you making X number of appointments, but what's going on in your life if you're not? Do you need a ride? We're providing mental health check-ins, just keeping up with our clients on the regular, checking in with them. Where are you? How are you doing? How are you really doing? I know you had X, Y, and Z going on. How are you feeling now? I myself check in with my clients every single week because of that. I didn't always do that. And then the pandemic came, and a lot of us became really hyper aware of the effects of situations like this on our mental health. And so I felt like, you know, I'm checking on everybody all the time. And now I see the value of us doing that for each other. So one of the ways I'll offer up for the community to show up for moms is that's our first one, showing up for moms, actually showing up, never assuming that everything is just well, never assuming it's okay. We all have those days where we're not okay, but we carry on. Everyone has done that at some point in time. Imagine how heavy that feeling is when you're going through hormone fluctuations and you have the demands of a new baby or maybe more than one child. It can really weigh on you and affect you, and it has nothing to do with how much you love your child. It has everything to do with the fact that we are wired in our culture to believe that mom means having it all together all the time, knowing what to do in all situations, never making a mistake. Going a bit further into the culture we're in now, we believe that mom means what we see on social media, the letterboard signs. I follow a lot of mom accounts and birth worker accounts, so this is all over my feed. But they have these letterboards, and it's like a one of the signs of, I guess, perfect motherhood. If you have one of those and you put what your child is doing today, and it's cute, and your child is sitting there perfectly behaved, and you're just, everything is all together all the time. A lot of times it's not like that. You may have those moments, but sometimes we struggle, and that's okay. But having someone who is going to show up and be present in your life, it really can help. It can make a difference. There's times when I wish somebody would call me. I was not going to reach outside of myself, but I wish somebody would call me. So we have to think about it like that, especially with our new moms, because that transition into motherhood, it's really something. And that's the thing, doulas provide care on both sides of that transition, during pregnancy, during all of these changes, during all of these things that you are anticipating, maybe fearing, helping you to untangle all of that, walking beside you with it. And like I said before, it's a constant check-in with you. How are you today? Those simple mental health check-ins that we can do. Maybe today is not the day. Maybe this whole season of your life is not the season. Now I know I need to refer you on to someone. There's someone we can bring into this situation that can help out before we get all the way to the end of this and we get to a crash and burn situation. So checking in those kind of ways. Like I said, I came into this work because of things that I lacked in my own maternal experiences surrounding the pregnancy year. I, not unlike a lot of people, hired a care provider, thought I was doing the best thing I could do. I was having a home birth outside of the hospital. That's it, right? That's all we have to do, get out of the hospital and everything is fine. But no, that's not the case. And I connected with the midwife. She had a great price. I went with her. We met once or twice and, things were okay, but it wasn't all good. And, the relationship I had with her, it was tense. I could never fully be myself. That's that culturally competent care. There's some things that are just understood that I don't have to say, I don't have to explain to you. And that puts me at ease. And really, the way you're made to feel when you're pregnant, when you're laboring, when you're in that postpartum period, it matters and it stays with you forever and ever. And you always remember the way that you were made to feel in that time when you were vulnerable and open in so many ways. And so having somebody there, I had a doula, but my doula also wasn't in a position to give me culturally competent care. And so a lot of my experience was misunderstood. If you come into my home, and as soon as you come into my home, you start telling me things like, I knew it was going to be incense and reggae at your birth. Those types of things have an effect on you. And then here I am laboring with my first child, and I'm on edge. I'm uncomfortable. I always tell my clients that anything you have that's anything other than happy going on in your emotional sphere during pregnancy, you got to deal with that, because if it's with you now, it's going to be amplified in the birthing room. It's going to be amplified in those early days of motherhood. So having a doula, you have this person to walk beside you in the journey and to sometimes recognize these areas where we need some intervention, we need some help, and we're not able to articulate it ourselves, or we don't even know where to go. What is it that I actually need? And we can provide you with that through referrals. But doulas are just one way. Having that type of care it definitely helps. It does shift the paradigm. But our mental health as moms, as melanated moms, is affected by so much. We are affected by the maternal health crisis. You can't be in a Black or brown body and be pregnant and, you know, hear these statistics that we hear all the time and not have some level of concern, you know, fear. The Black maternal health crisis, you know, being at the forefront, we know that Black women are dying at a rate, you know, that is just higher than any other race. But just in general, Black and brown women, we are behind the curve when it comes to improvements that could be made, adjustments that could be made. That affects our mental health. Imagine knowing you have this baby growing inside of you for all these months, and also knowing there's a really strong likelihood that I could die in this situation. These are otherwise healthy mothers who we're losing to this maternal health crisis. So that affects you. That definitely has an effect on your mental health. If you have other children, our mental health affects the way that we show up as mothers. You know, there are days, you know, when you may not be feeling it and you push yourself through it as a mom, but what happens when those days, you know, turn into darker days? And if we have no outlets for this, it starts with this conversation. It starts with these types of conversations and talking about maternal mental health. Because I'll pause and back up for a minute. Go only about a generation before most of us here in this room, generation, 2 generations, and maternal mental health was not a part of the conversation at all. You had stories like my grandmother, who, you know, it was a family story passed down that we all knew. My grandmother had my mom, and before she had my mom, she had had pregnancy loss. This was not something that was spoken of at that time. You don't talk about that. It happens, and you know, you come home, you never speak of it again. But my grandmother experienced this loss, multiple losses actually, and then she had my mom, and by all accounts, for the next 4 years or so, she just wasn't herself. And that happens a lot. You know, we have those stories, you know, in our families, just, you know, so-and-so just wasn't right. You know, mom was there, but she wasn't there. She just was sad all the time. And we didn't have the words or to talk about mental health in the way that we do, just because we never heard those words from anyone before. So we look at our parents and our grandparents and, you know, previous generations, and we're like, how could they have, you know, there's a lot of trauma that can come from the way we were raised, but we have to look at, well, where did they come from? Did they ever have an outlet for what they experienced? When we look at the effect of these, you know, tragic events in a mother's life of loss, and knowing that these types of things were really prevalent for our communities before we were able to get access to care on a widespread basis like we do now, we didn't have ways to deal with that. So there is a lot of trauma that we pass down, and we are dealing with that, and we're untangling it. And it starts with this conversation around mother's mental health. It does matter. Motherhood is not synonymous with martyrdom. Motherhood doesn't mean that, you know, you push through the pain and that's your lot in life because you chose to be a mother. It doesn't mean that. And we have these extremes with motherhood, especially, you know, with the way social media shows it to us. We either, you know, we hate it, we complain about our kids all the time, or, you know, we're at least singing and everything is always perfect. And, you know, we just have nothing but sunny days. And there's so much in between. You can have difficult days. You can have days where you're struggling and still be a great mom. You know, still love your children and put your children first. That is just a part of our experience. And there's no problem in you know, realizing that we're having struggles. The problem comes when we realize it and we do nothing about it. That's when we get in danger of those situations where we're passing trauma down to our children because we haven't dealt with it. So it's important that we have the conversation around maternal mental health from the very beginning. I talk about it in my pregnancy classes. When we talk about preparing for postpartum, postpartum prep is something that it's not as popular as birth prep, birth plans, we know all about those. We're making a plan for the postpartum. A lot of times that's where our mental health struggles begin. But did you know that there is such a thing as perinatal depression? A lot of mothers suffer in pregnancy. I suffer myself from perinatal depression and had no idea that it was even a thing. We never hear the conversations around me. So that's why we can show up for mothers in our communities by being willing to educate ourselves on postpartum depression, prenatal depression, maternal mental health, period. Why? Most of the time people around you start to notice the signs that you're struggling before you do. In those early days, especially as a mom, when we just want to get it right. We just want to feel like I'm acing out. I want to do it like I saw so-and-so do it. And so in those early days, we mask a lot. We just try to keep going. I'm tired and it's starting to affect me. It's the way I feel. I'm so tired that I'm going in the bathroom and crying. But I'm just keep going because I haven't seen anybody else complain about it. So we just push it down as deep as we can and we keep moving forward. We have to be willing to start that conversation for moms. A challenge to all of you. We love babies. We all love babies and they're so cute and we focus on them so much. But the next time you visit a new mom, instead of asking her questions only about the baby, what's he doing now? What are they doing? Are they eating? Are they sitting up? Are they rolling up? What about you though? What about you? Because another mental health struggle is stemmed from the fact that so often in motherhood, we feel like we lose ourselves and we feel like we can only identify as mother. As awesome and amazing and great as that is, we're allowed to have many facets and many layers, and we should explore those. It shouldn't have to be when my kid is 18 and they're out of the house. We should be able to explore what makes us happy, what makes us who we are, the entire motherhood experience. And when we have those times to refresh ourselves and to indulge ourselves in what makes us feel joy, we come back better for our children. We come back better for them. When we take time to see about our mental health, we take that time out and, maybe we struggle with mom guilt and feeling like, well, I'm doing something that's just for me and I should be able to just get it together. But when we do that, we're actually doing it for ourselves. We're doing it for our children. I read somewhere once that we're even healing the generation before us. And I believe that to be true. The mental health conversation in our communities is opening up. So we can't leave motherhood behind. We can't leave that as the final frontier. Mom means strong, maybe, but not all the time. Mom means human being who happens to have carried and birthed a child.
Question. When you're talking about melanin moms and mental health and the whole cute baby concept that you were talking about, oh, the baby's cute, and you're sitting there still physically challenged, mentally challenged from having a baby. What are some questions? You said, how are you, but what are some more questions that us as a community can ask our moms, right after, giving birth, 6 months, a year later, 2 years later, because some moms are still breastfeeding at that time and everything else. What are some good questions that we can ask, or how can we show up?
I want to touch on some things to ask and then some things to not ask.
Okay.
You mentioned breastfeeding. Breastfeeding is a source of a mental health struggle for many moms. And we don't understand that before we get into it. We don't understand how this situation can affect our physical flesh as well as the state of our mental and emotional health. And it really can. What we don't need to ask in those times is questions like, so how long are you planning on doing this? It seems like it's not going well. You just want me to pick up a can of formula? That's not the type of support that mom needs. Do you plan on just giving the baby the breast? Can anybody else give the baby the bottle? Or if a mom is formula feeding, did you try breastfeeding? You didn't want to breastfeed? Whatever someone decides to do to feed their child is their business. However they decide to feed their child. If they want to take a spoon, put milk in it, spoon feed that baby, that's their business. It's their child. And I think a lot of new moms don't realize that they have the power to tell people to step off and set those boundaries, and say, this is my choice and my decision. This is what is best for me and my family. Other ways you can show up are literally to show up with things, okay? especially for families that are adjusting to having more than one child. We always think of, oh, my first child, but that's a leap also, going from one to the next. Families in those situations, you can show up for them by offering to help them out with the older child. The older child is not the focus, it's not the cute baby, but a lot of times that's a struggle for new moms, going from 1 to 2 or 2 to 3, feeling like their time is split and their attention is split, and is my child okay? Are they feeling like they're still getting to have fun and do different things? Show up for them in that way. Another way that you can show up is asking them how they feel physically. Being specific when we ask a new mom, how are you doing? How are you doing? It's easy to just say, the blanket, good, I'm all right, I'm all right. How are you feeling? How's your healing going along? Is there anything I can bring you for that? Are you in pain in any way? Is there something I can do? I've seen new moms who have been home 2 days, little to no help, and need a simple thing like, need help rewrapping their belly or something. And nobody asked them though. And, yeah, maybe you have a whole partner and they're there, but you don't know the difference that it can make for you to ask that person. Maybe, they're just uncomfortable in this season in their life with other people. Just offer it. The help can be turned down and that's fine. And sometimes you can just show up, bring things, bring food. Food is also always welcome. It's always welcome. Diapers, yes, that's great. But actually taking care of these people who are probably not sleeping in the way that they should, probably not even thinking to do the simple things all the time, like eat, like have some water. So simply showing up for, a family with a new baby, with something like that feels like love. I had someone do that for me when I came home and I had meals for the first week, and that felt like one less thing that I needed to worry about so I could relax a bit more, because I was frantic in my mind thinking I've got to, ace new motherhood, I've got to ace breastfeeding, I got to take care of this child, keep the child from crying, they're crying again, and I got to fix something to eat and all that. It's just one less thing. Asking them what else you can do for them. Is there anything else I can do for you around the house? Do you need anything? Do you need anything that I can pick up? I don't have to stay, because we don't always need to be there, like right there, that space is good as long as we're giving someone to check in regularly, but just asking, can I drop something off? Can I bring something by to you? Is there any way that I can come and sit with the baby for you for a while so you can just have a moment to yourself? Encourage them to do that. Encourage them to take moments to themselves. It's easy to get into a bubble when you have a baby or even with an older child, and not come out of that and not realize that, I haven't had a grown-up conversation this week. It's been all Blue's Clues and Baby Shark, and I, really not okay about that. Just having a conversation, just calling, checking, seeing how you're doing. I'm here. You want me to come by? Offering to play with the kids for a little while. Just being there, just actually being there. One other thing I would say is that it's not always necessary to offer up a solution. Sometimes we just need you to listen. There are a lot of parts to motherhood that are difficult at whatever stage you're at. And, a lot of times we get that and we know, and we're committed to the process, but it doesn't mean I don't feel a way about it. And sometimes I just need to say that. I just need to talk about how I feel, and that's it. I just want to say it and get it out. And so to be that and to be willing to be open and to receive that when a mom needs it, that's some ways we can show up.
Good question. I guess outside of what you already said, how can the man be more supportive for the woman that's going, just had a baby?
I'll start with that
even
in pregnancy. Yeah. I'll start with that in pregnancy. Being there matters, but this is the thing, understanding that in being there, we need to still be fluid, okay? We need to be willing to be like water and take on whatever shape is necessary. Show up how she needs you to show up. And that's the same in labor as well, let's say. It may change, the example in labor, maybe for most of the time, I want you right there. I need you right here. I need to see you at all times. But then I need you to step off and not say anything else. And understanding that having an extra measure of understanding is important. I think in this time, knowing that, there are some factors that are beyond control. And there are some times when, emotionally, the way that ease can come is just from someone else trying not to control the situation. Back to that, not always offering a solution, just being a listening, safe space at times, and being invested in this birth. It's important that everybody who is at the birth knows what's in that birth plan or whatever birth wishes that mother has, because one of the biggest things you can do, I'll tell it to you like this first. First of all, and especially if we're going into a hospital birth situation, don't be there unless you're willing to just put your body over her if it comes down to that. And I mean that. And I'm willing to do that if I have to do it, if I'm gonna show up. But if you're gonna be in there, be willing to do it in that way and be there with the mindset of I'm here to protect, knowing what we're up against. Like I said, in these hospital systems, we can't go in all willy-nilly. We can't go in thinking it's all good, because it's not. If it were all good, then we wouldn't have all of these Black and brown women who are going in, and then only dad and baby are coming out. So be willing to look out and protect, know what she wants, advocate for that, actually look and see what is going on. I had a client once who was resting in labor, and one of her wishes was to not have Pitocin. When you come into the hospital, they go ahead and set you up with the IV just in case you need medication. While she's resting, I'm off to the side with her partner, and a nurse comes in with a bag and starts walking over to hang it and hook it up. The doctor and the nurses felt like she was taking too long in this stage of labor. So without discussion, they were going to put her on a Pitocin drip. And I'm poking Dad, hey, ask them, what is that? And she's like, oh, it's Pitocin. We're gonna get some Pitocin started. It's been a while. But is that what you want? Is that what she wanted? And so she's tired. So it ought to be enough, though, if I'm gonna be there with you in that room. I'm not just there to take pictures. If I'm gonna be in that room with you, I'm willing to lay my body over across you if I have to. And I'm going to watch out, I'm gonna protect, and I'm gonna speak up and be willing to do that.
Sure.
And when the baby comes too, it's just as important, because they do a really good job of making you feel like, you can't even take care of your own child in the hospital. You can't fall asleep with the baby on your chest, one of the most natural behaviors that there is. You can't, in some places, depending on the type of birth you've had, you can't walk holding the baby. You gotta put your baby in a little plastic box and push him around, so just that role of protector, understanding what that means and understanding what it means to accept and act on your rights as a parent, and being willing to state what is wanted and restate it as needed.
How about postpartum?
In postpartum, I would say not having a timeline for that, understanding that postpartum healing is not linear. Having that extra measure of patience, like I said, is really important. And that goes not only just for our emotional and mental state after having a baby, your physical healing too. Nothing is necessarily linear. And you can have a day where you feel absolutely amazing on top of the world. And then the next day, everything is the opposite. And so not having expectations, especially when you're not inside of that birthing body that's healing. Anything outside of that just needs to have some understanding and a lot of time to just quietly listen and understand what she needs. As that changes, it may change. The other thing is, don't think that you have to be everything, partners. You don't have to be everything. I use a postpartum planning guide with my clients, and in that, I ask them to go through, who is your village? I tell them to think of people who've had children in the last 5 years, so they still remember what that's like. And those are your people, because I may be your partner, I may be really close to you, but it may not always be me. We can be in love, but it's not always me. I'm not always the one to get through to you when needed. And maybe there's one of those days. Maybe it is me. Maybe I'm the reason, So be willing to allow the village to come in and step in as well. Mm-hmm.
As far as intimacy after pregnancy, your thoughts on that, in regards to relationships and the woman feeling comfortable with her body and and all of that.
We need to let go of this notion that being cleared at the 6-week checkup means 6 weeks, time's up.
Yeah.
we have to let that go. The way that you feel about your body after pregnancy, you know, most times it's different. That period of adjustment has to be respected. It's rarely 6 weeks.
That's what I'm saying.
If you really get down to the truth with most people, it is rarely 6 weeks. People need more time, and that should be respected. And that's the way that partners can really come through, is understanding that and understanding all that has happened. In a lot of these situations, we have had a birth scenario that, you know, involves some things that we were not planning, and we're dealing with that, and we're healing from that, and you know, understanding what that even feels like. Because those things you deal with for so long afterwards. And so if you're not willing to understand that after this whole human has come through, then that's an issue that I would say the partner needs to do some work on themselves. And that's why it's important for partners to be involved in things like birth education, because in those times when we're learning about postpartum, you're taking that information in too. It shouldn't be a thing that, oh, that's just you, that's all about you, because it's gonna take everyone. You know, it's gonna take us all the whole way through. And so it's important that we understand what's happening. And it's also important that we understand that mental health aspect and that conversation, which is that hormone fluctuations in your body can change your sexual desire. And that's science. You know, so, you know, you may be sitting here thinking it's just me, it's not, you know, and so that is another conversation surrounding our mental health that we need to understand that, you know, there are definitely a lot of avenues that we can seek to try to work through what we're experiencing, but, you know, anyone who's making you feel like it's just you, they're a part of the problem. You know, your body has gone through tremendous amount of change. Experts are even starting to recognize that postpartum is much longer than we've said before, years beyond what we've known it to be. And so if we look at it in that way and know that, you know, even up to 5 years after you've had a baby, you're still adjusting and healing in many ways. You know, you could still have some pains around a cesarean incision site in that amount of time. So we're literally still healing in so many ways, and to have patience with ourselves in that process, especially, you know, and understanding that, you know, you may be learning your body all over again and learning what even feels good. And so taking that time, but it's a conversation that needs to happen during pregnancy. Expectations are one thing, but, you know, where they always go wrong in a relationship is when they're one-sided because only one person knew, you know, and so having those conversations and, you know, this is some of what we could expect because we don't even know. I don't know what's going to happen in postpartum, but at least talking about what the ideal postpartum healing scenario would be. And, you know, what do you need? What do you think you're going to need from me, from the other people in our lives? How can I show up in a way, you know?
I have a question. You were talking earlier about how one of your colleagues or one of the doulas was getting judged when she was going to the hospital, and they were writing things in her chart about how she was dressing, like it's supposed to matter when she's giving birth.
Right.
And it like, I'm still trying to process that, but it took me back to when I was 16. My best friend was pregnant. She got pregnant. She's a teen mom. She's a young Black girl. She has the baby, and mind you, she's 5'4". No, she's 4'11", 90 pounds soaking wet. When she's pregnant, she got up to 100. She has the baby. It was a cesarean, and the doctors left gauze inside of her body. And even now, 35, I can't help to think why that happened in such a little body with a 9-pound baby coming out of it. How do you miss something like that? And it takes me all the way around to our mortality rates in mothers. How do we address that, like in our communities?
Yeah. We have to understand that, you know, this whole narrative of the hospital being the safest place to have a baby is not the case. That's not the case. We have to understand that a lot of fear-based maternal care happens. Many of us are in situations because of insurance coverage limitations like that, you know, this is what was available to me. But this is why the broader community needs to support more birth workers of color and needs to get behind those of us. I'm a student midwife. I know many student midwives who we desire to be in this space and to show up for our sisters when they need us. The community needs to support those efforts more. That's a big, huge part of the equation. We have to bring women into a safer space. We have to have more care providers that look like us. We have to understand when the jig is up, and it's now. We can't look at the maternal mortality crisis and believe it anymore that the hospital is the safest place, because it's not. I would recommend that you start by reading Medical Apartheid and let that be a place to understand how the harm that has happened to our bodies throughout history in this country. And it's not surprising. There was a baby who was recently in the news because she was cut. She had several cuts on her face following a C-section. And you know, those stories happen all the time. You may not hear them all the time, but when you're plugged into this world, like this is all that we hear. This is all that we know. Maybe you don't know anyone who's been affected by the maternal mortality crisis. I have about 20 names right here, you know, and
I mean, even Serena Williams.
Beyonce, Serena Williams, and they live to tell about it. And many don't, you know, many situations of harm in the pandemic. It's been crazy because many doulas have been blocked out of going in to support our clients. There have been a lot of policies that have affected Black and brown doulas more than any others. Policies like only allowing doulas with certification from the major certifying bodies like DONA to be present at births. Most Black and brown doulas don't go through DONA because DONA has a history of doing harm in our communities. So we go through other avenues to receive our training. So when we have a policy like that, who's affected most? We are, and who are we serving most? Us. So then all of a sudden you take my eyes, my advocate out of the equation, and I'm in here and there's all kind of foolishness happening because maybe I've never been through this situation, but the person who I was counting on their experience and they have been through it to let me know like, no, that's not normal. That's not what really needs to happen in this scenario. They're not there anymore. And what happens if we go into these situations, they call it the white lab coat syndrome or something like that, where it's basically this assumption that this person has absolute authority. And we have that notion anyway, that when you're pregnant, you go and sign up under somebody's authority and you go and do what they tell you to do and they know what's best, even though you've been in this body your whole life. Even though nobody's feeling what you're feeling other than you. I've seen even midwives who will swear to a laboring mom that she can't possibly be, you know, ready to push or feeling the baby because she's not acting in a certain way that this care provider is used to seeing people act. That's just not how she's acting. Meanwhile, you know, they're suggesting, okay, just change positions, you'll be fine. We go to move your leg and there's a head. Because they don't listen to us. That's how we can also show up. Listening. When we're telling you these stories, we've been in those birthing rooms. We've been there, we've seen it happen. And you should really listen and believe us because the information that we share can save someone else from having to go through that experience. I have to mention the Earth app. The Earth app is doing a really, really amazing job at trying to put a stop to some of this because this trauma we take from our birth experiences that for so long, you know, all of our foremothers just accepted as a part of the process. Now we're understanding like, no, that's obstetric violence. No, that's birth rape. No, I don't have to do that. That's your preference. Hospital policy is not law. Now we know all of these things and we're speaking up about the mistreatment. So the Earth app is founded by Kimberly Seals Allers, or maybe Allers Seals. And it's basically, think of it as a Yelp for women of color to go and share experiences related to birth with either obstetricians, midwives, or at a particular birthing So you can go into there, if you've had an experience, talk about it, because it's gonna keep on happening. If Dr. So-and-so is known to, you know, treat patients in a certain way, that doesn't mean that they're gonna boot him out of there. No, that doctor who left that gauze probably had some type of other infraction. Having infractions doesn't mean that you can't practice. You can do it, you know, especially if, you know, you're up against some folks who don't have the time or money to fight it. You're just gonna keep on going. And why would we listen anyway? When, you know, within the past 10 years, we have studies done, you know, surveying residents and medical students and asking them questions that you would think, you know, would reflect opinions from the 1930s or something, and they're still giving up answers like, well, black women's skin is thicker, you know, it's harder for them to feel pain. So then if this is the mentality, how are you gonna treat me when I'm there in front of you? I had a great opportunity to speak to some medical students at the University of Texas who are specializing in women's services. So there'll be future OBs and maternal fetal medicine specialists. And, you know, we talk about how the issue is not necessarily just with having more care providers that look like us, because if they're still following this allopathic model of care that doesn't see us and doesn't care for us, and care should be a part of the equation. It shouldn't be just business, not when you're dealing with my body, not when life and death is a part of the equation. You should actually care whether I live or die. And we've become disconnected from that aspect of people who were traditionally our healers, who were a part of our community. It's not that anymore. And so we're in these situations with people who they don't really care. Listen, talk about your experiences. If you've had these experiences, use the Earth app. It's IRTH, like birth, but we take away the B for bias, because we're trying to remove that and call these people out. We're calling them out on what they're doing. You know, we're letting them know that we see and we know, and we're tired of it.
Tired. We're absolutely tired of it. Sierra, you're amazing. We can't go without shouting out your show on All Real Radio, because your voice, her voice over the radio sounds 1,000 times even better than what we're hearing in person. Like your voice is soothing. Like I could listen to you talk about this, especially because it's so needed and it's so important. Let's give her a round of applause, because we're at 3 years ago. Okay, so shout out your radio show, because you did it this morning. You came over here. Oh,
Yeah.
some conference.
So tune into Homeschool in the Key of Life with me, Sierra Sankofa, every Saturday on All Real Radio, 9 a.m. 9 a.m. Central. You can tune in from anywhere, www.allrealradio.com, or you can download our free app. Homeschooling tips, tricks, hacks, tools, interviews with all different kind of folks. I just started the Life Path series, which is a series that is exposing our youth to different life paths, different things you can do. You know, we grow up and a lot of times we hear the same little set of what you could do and what's a possibility. And it takes us till our 20s and 30s and 40s even to figure out that I could have been doing my own thing all along. So like, I've already had one episode. I had Kelly Brown, the founder and CEO of Spread Karma, a Black-owned company in the crowdfunding space. She talked to the kids about what it means to be a founder and a CEO, and what do you do when you want to start a business? How do you actually go about that process? I'm going to have artists on, journalists. It's everything. So tune in, Homeschool in the Key of Life.
I have like a year of people you can talk to. The
Hey,
space
send them my way.
The space members are on already. So we have a couple of questions before we get off.
No questions.
No
I just wanted
questions?
to give you your flowers because this chat just.
Oh,
really went
wow.
off.
Yeah, it's doing it.
Josie, Kelly, Salinas, Linda, Yvonne, everyone was loving your insights. Yvonne says she wants to review all 3 of her birth napkins.
Come on, Yvonne, I got you.
Kelly's like, I want Sierra to be there for me when I'm expecting my first child. She's available to hire right now, you know, who could use your services. Is that true?
Yeah.
So,
Yeah, I support moms virtually and in person. So
lovely. Yes, thank you so much.
Yeah, amazing. So a couple highlights that I wrote down, because I have my handy dandy notebook. I've been doing good today.
not the blues clues,
Not the handy dandy notes, see, because you said that. So I wrote down, okay, yeah. So have an extra measure of patience. Dads, partners, when the mother's pregnant, have an extra measure of patience.
If it's not your uterus, then you're the one who needs extra.
Right, right. So if you tell me to stand on this side and you're like, no, move, I should just like go over here and then we're comfortable in it, right? Okay, so we did that. And then you also talk about motherhood is not synonymous with martyrs and being a martyr, right? Yeah, you don't have to struggle
No.
just because you're a mama.
Nope.
I love that. That's like one of my favorites. We might have to stick that on a We Got a shirt, right? I love that. Do you have anybody else you want to shout out?
Yes, so I want to shout out to my doula collective here in Houston, Holy Mama with the Women's Earth. Those are my people. I want to shout out all of the birth workers out here working hard, trying to make change. Shout out to my Spread Karma family, Love, Unity, Loyalty, and Karma, and to my All Radio fam.
Yes, I love that. So the way you feel when you're pregnant stays with you. It just stays with you forever. Yeah, yeah, I love this. Thank you. We appreciate you. Y'all, next up is, hey, big head. So we're gonna take a brief break. We're gonna reset and we'll be back with everybody in like 2 minutes because everybody's already here. All right, thanks, y'all.